So the pandemic has affected people of all ages, and when it comes to mental health, there's been a rise in children being hospitalized.
There is also more students needing intensive therapy as they've returned to school. Jessica Knudsen from Clarity Child Guidance Center is joining us now live to tell us more. Jessica, tell us about what challenges children are facing the most right now.
Well, I think it's a combination of factors. I think you've got some kids that are really overwhelmed by some social anxiety right now because of the experience of the virtual learning, and they were out of the classroom. That wasn't a fit for some kids, but some kids really thrived in that. You know, maybe they had a bullying situation when they were in live school and they got to escape that for a little bit. Now they're right back in it. So we're really seeing a spike in kids that just socially are having a hard time getting back into the classroom. I think that is combined with some of the academic struggles that kids are facing right now. A lot of kids got very behind during the virtual learning time, and not a lot of kids got left behind. So they're in a new grade with the expectation that they've mastered the material of the previous year. And so we're finding a lot of kids really struggling with that and bringing on some depression because they're just not performing academically.
Yeah, that transition has certainly been tough. And of course, many of us want to know, what are some ways to help kids who may be struggling? What can we do?
I think the biggest thing is for families to be very communicative about this. I think asking questions, don't wait to see a sign of depression or anxiety in your child. Start the dialogue. You know, if you've had a child that's transitioned from virtual learning to in-person learning, chances are they're struggling with something. So have that conversation with them. And if they're struggling, get help early. You know, what we're really seeing on our end is that there's so many families in crisis. And so they're coming into our emergency services department where maybe we could have done an intervention a little bit earlier on if we had kind of identified things or gotten a kid into treatment a little bit earlier on.
And you are seeing burnout with some caregivers. What can we do to help that as well quickly?
I think that's very similar. I think the teachers are the forgotten victims in this. You know, they had to, you know, pivot completely and learn how to virtually teach, and now they're thrust back into the classroom. And they're not only dealing with the challenges of dealing with the kids' issues, but also still the ongoing fear of the virus. You know, there's that overwhelming anxiety of COVID still, and if we're doing in-person teaching, is there a risk of exposure? And so it's very similar. I think talking to our teachers, talking to our caregivers, making sure they have the support, making sure they're doing self-care and getting into treatment if they need it.
Thank you so much, Jessica. We know you have ClarityCon coming up on November 5th. We have those details at kens5.com. Have a great day.
Thank you. You do the same.